Vertigo. Vertigo is a symptom, rather than a condition itself. It's the sensation that you, or the environment around you, are moving or spinning. This feeling may be barely noticeable, or it may be so severe that you find it difficult to keep your balance and do everyday tasks. Attacks of vertigo can develop suddenly and last for a few seconds, or they may last much longer. If you have severe vertigo, your symptoms may be constant and last for several days, making normal life very difficult. Other symptoms associated with vertigo may include loss of balance, which can make it difficult to stand or walk, feeling sick or being sick, dizziness. The ears roll. Inside your ear is a tiny organ called the vestibular labyrinth. It includes 3 loop-shaped structures, semicircular canals, that contain fluid and fine, hair-like sensors that monitor your head's rotation. Other structures, otolith organs, in your ear monitor your head's movements. Up and down, right and left, back and forth, and your head's position related to gravity. These otolith organs contain crystals that make you sensitive to gravity. For many reasons, these crystals can become dislodged. When they become dislodged, they can move into one of the semicircular canals, especially while you're lying down. This causes the semicircular canal to become sensitive to head position changes it would normally not respond to, which is what makes you feel dizzy. Diagnosing vertigo. Details of the first episode of your symptoms and what they were, for example, whether you felt lightheaded or if your surroundings were spinning. If you also experience other symptoms, such as hearing loss, tinnitus, nausea, vomiting or fullness in the ear. How often your symptoms occur and how long they last for. If your symptoms are affecting your daily activities, for example, whether you're unable to walk during an episode of vertigo. Whether anything triggers your symptoms or makes them worse, such as moving your head in a particular direction. What makes your symptoms better? Physical examination. Your doctor may also carry out a physical examination to check for signs of conditions that may be causing your vertigo. This could include looking inside your ears and checking your eyes for signs of uncontrollable movement, nystagmus. Your doctor may check your balance or try to recreate your symptoms by asking you to move quickly from a sitting to a lying position. Further tests. Depending on your symptoms, your doctor may refer you to a hospital or specialist for further tests. Hearing tests. If you have tinnitus, ringing in your ears, or hearing loss, your GP may refer you to an ear, nose and throat (ENT) specialist, who can carry out some hearing tests. These may include an audiometry test. A machine called an audiometer produces sounds of different volume and pitch. You listen to the sounds through headphones and signal when you hear a sound, either by raising your hand or pressing a button. Tuning fork test. A tuning fork produces sound waves at a fixed pitch when it's gently tapped. The tester will tap the tuning fork before holding it at each side of your head. Video nystagmography, VNG, is sometimes used to check for signs of nystagmus in more detail. Nystagmus can indicate a problem with the organs that help you to balance. During this test, special goggles are placed over your eyes and you'll be asked to look at various still and moving targets. The goggles are fitted with a video camera to record the movements of your eyes. Electronystagmography may also be used, where electrodes are placed around the eye instead of goggles. Caloric testing. A caloric test involves running warm or cool water or air into your ear for about 30 seconds. The change in temperature stimulates the balance organ in the ear, allowing the specialist to check how well it's working. This test isn't painful, although it's normal to feel dizzy during the test. This can sometimes continue for a few minutes afterwards. Posturography. A machine to test your balance may be used to give valuable information about how you are using your vision. Proprioception, sensations from your feet and joints, and the input from your ear to maintain balance. This may help to plan your rehabilitation and monitor your treatment. In some cases, a scan of your head may be used to look for the cause of your vertigo, such as an acoustic neuroma, a non-cancerous brain tumor. Usually, either a magnetic resonance imaging (MRI) scan or a computerized tomography (CT) scan is used. An MRI scan uses a strong magnetic field and radio waves to produce a detailed image of the inside of your head, whereas a CT scan uses a series of detailed X-rays to create an image. What tests will be done to diagnose vertigo? Vertigo can be diagnosed with tests performed by your healthcare provider. These may include Fukuda-Unterberger's test. You'll be asked to march in place for 30 seconds with your eyes closed. If you rotate or lean to one side, it could mean that you have a problem with your inner ear labyrinth. This could result in vertigo. Romberg's test. For this assessment, you'll be asked to close your eyes while standing with your feet together and your arms to your side. If you feel unbalanced or unsteady, it could mean that you have an issue with your central nervous system. Head impulse test. For this test, your provider will gently move your head to each side while you focus on a stationary target, for example a spot on the wall or your provider's nose. The clinician will be checking to see how the inner ear balance system is working to help control your eye movements while your head is in motion. Vestibular test battery. This includes several different tests to help identify an inner ear problem. Goggles are placed over the eyes to monitor eye movement responses while moving your eyes to follow a target. Moving your head and body, and even after warm and cool water are put into the ear canal. In addition to the tests outlined above, your healthcare provider may request radiographs. These may include CT, computed tomography, scans, magnetic resonance imaging, MRI. Management and treatment. Will vertigo go away on its own? Vertigo goes away on its own in many cases. However, there are several treatments that can successfully manage vertigo. What are common vertigo treatments? The vertigo treatment that's right for you depends on several factors, including the root cause. Some of the most notable vertigo treatments include medication. Treating the underlying cause of your vertigo can help ease symptoms. For example, if vertigo is a byproduct of an infection, your healthcare provider can prescribe antibiotics. Steroids can help reduce inflammation. There are also medications to relieve other vertigo symptoms, such as nausea or motion sickness. Vestibular rehabilitation. If vertigo is the result of an inner ear problem, this type of physical therapy may help reduce your symptoms. Vestibular rehabilitation helps strengthen your other senses so they can compensate for vertigo episodes.
9.
Canality repositioning procedure, CRP.
10.
If you have BPPV, canality repositioning maneuvers help move calcium deposits into an inner ear chamber where they will be absorbed by your body. Surgery. When vertigo is due to a serious underlying issue, such as a brain tumor or neck injury, surgery may be necessary. Are there any home remedies for vertigo? There isn't enough evidence to prove that vertigo can be treated with alternative therapies. However, some people take herbal supplements to ease their symptoms. Popular herbal vertigo remedies include turmeric, ginkgo biloba, cayenne, ginger root, gong jin dan. Be sure to talk to your doctor before adding any herbal supplements to your diet. They can help you safely incorporate them into your regimen.